So the number of cases here at home across the U.S. topping 16,000. More than 200 Americans died from the virus. Dr. Anthony Fauci, the government's top expert on infectious diseases, joins me now from Washington. Sir, thank you for your time. And you can imagine viewers across the country and around the world, they have so many questions about this. So I'll get to as many as I can over the next couple of minutes, okay? My first question for you is what you said a bit earlier today. You said we're looking at least several weeks at this current trend. You're studying trends from all over the country. Why did you put that timeline on it, sir?
Well, if you look at the curve of the outbreaks in places that we now have unfortunate experiences, look at China, look at what happened in South Korea, look at what's happening in Italy, you see that the outbreak putters along and then it goes way up, peaks, and then comes down. The height of the peak and the duration is obviously influenced by the things you do to mitigate it, the kinds of things that we're doing right now, physical separation of people. But if you take a look at a typical duration of an outbreak, it's measured in a few weeks. I mean, the China one was about 6 or 8 weeks before it was really way down. Others are maybe a little bit less, 4 to 6 weeks. But it's certainly, if you want to say when from the time you know you're starting to see cases, community spread, to the time you peak, there's no question when you look at the various models, that is going to be a few weeks.
I've got a specific question about that. I want to show you something. I don't know if you can see a monitor where you are, but
no, I can't.
What you're talking about is exactly showed on this graph here, okay? Italy, South Korea, and the United States. Italy goes straight up, doctor. South Korea is a bit of a flat line here, and the U.S. is just crossing over that South Korea line. Here's one more for you, sir, just to make the point. In South Korea, of those who have contracted the virus, the death rate in South Korea is 1.1%. In Italy, it's well over 8% there. What can we learn from the South Korean experience so far?
Well, you know, it's very difficult to really compare death rates unless you get all of the information that's very specific for a country. It could be. And again, I don't want to be talking without data, but I think the most logical issue for Italy is that, one, they have an older population. And as a matter of fact, the serious consequences, such as hospitalization, intensive care, and even death, are very heavily weighted towards both the elderly and those who have underlying conditions, heart disease, lung disease, diabetes, etc. So they probably have a demographic population that's a bit different than South Korea. But the other thing is that they may have been so overwhelmed that what they had is that they ran out of the kind of intensive care capabilities that you would like to give the maximum care to an individual. So when you overwhelm a system, you're not able to give maximum care. So they may have been really double whammy. One, they have a population that's an older population, but they have been terribly hit very strongly, very unfortunately.
And we're trying to prevent that. I know you put the clarion call on that almost every day, but from Italy, they say most of the cases today were heart disease and diabetes, so that fits exactly what you're trying to explain. Let me try and just move this forward a moment here. You spent a lot of time with the president the last couple of weeks. Was there a bit of information that was given to him or that he understood earlier in the week or perhaps a week ago where he adopted we're at a medical war posture?
So. Yeah. Well, I think he's a smart guy and he sees what's unfolding in front of him. We brief him very frequently. Like lately, it's been almost every day. So as the cases throughout the world, I think particularly what went on in Europe, specifically with Italy and with France, I mean, that really caught his attention. I mean, obviously, China was an explosive amount of infections, but that was really emerged from China. So you might expect that maybe it wasn't going to spread to other places. Those of us in the medical field felt that it very likely, since you have a lot of international travel, that it would spread. But when it went to Europe, and also in the United States, and when you see Italy do that, I think that would catch anybody's attention.
So, speaking of Italy, we picked up this video literally from the Associated Press earlier today. This is a hospital in northern Italy. And what you see are patients in beds, and their heads are encased in some sort of bubble or plastic cone. Now, what would be the reason for that? Is that a makeshift ventilator, or are they doing something there in Italy to make sure they maintain life in a way that is medically revolutionary, doctor?
Well, I can't see it because I don't have the visual in front of me. But, you know, being a physician who's taken care of a lot of sick patients, it very well may be that what they have is they're flowing oxygen in under pressure in this little bubble. I don't know for sure, but that's the most likely
What the
thing.
reporter described is that they're trying to replicate the air pressure in the lungs in that casing above their heads. So that may be that. Let me move on here a little bit. You've said a couple times, if you're not overreacting, you're probably not reacting as much as you should. Now, I get that here in New York City. You're from New York. But how does somebody in Toledo, Ohio, understand that when the problem for them seems so far away?
Right. That's a very good question. And that's the reason why you have to be somewhat proportionate in what you do. A few days ago, last week, we put out a list of guidelines that people should follow, such as getting people who are elderly or with underlying conditions and essentially have them stay at home and not be outside physically. There were guidelines about avoiding crowds, guidelines about numbers of groups of people, about only doing necessary interaction. I think throughout the country, to a greater or lesser degree, some degree of mitigation should be practiced. And we call that mitigation more like some physical separation, wash your hands, all those kinds of things. In certain areas of the country, it's different. Look at what's going on in California, what had gone on in Washington, and now the very, very steep curve in New York. So the people in New York, trying
to get people to understand that can be a difficult thing, and I know you're doing your best. I've got 3 more minutes. I want to get to a few more points.
Okay.
Senior centers and nursing homes are under great strain and concern. What is your message for them now, doctor?
Well, first of all, the message for the people who are taking care of them, they've got to be very careful and almost assume that you are infected and that you are a risk of infecting these senior citizens who are in nursing homes, so that you'll go to the limit in trying to protect any transmission from you. And that means washing your hands thoroughly, making sure you're very careful in what your interactions with them are, and also what we should be doing is limiting visits from the outside into nursing homes. I know you want to see your loved one, you want to interact socially, but for the time being, you should not have anything but absolutely necessary visits to the nursing homes.
Okay, now from the briefing earlier today, you seem to dismiss the suggestion that chloroquine, an anti-malaria medication, can have much of an effect. And if I heard you correctly, you said we just haven't had enough time to figure that out. Is that an accurate reading on your answer for that medication?
You know, I'm not dismissing it at all, and I hope that interpretation wasn't widespread. What I said is that we don't have definitive proof that it works. So what we need to do, since there are suggestions anecdotally that it works, try to get it available, but to do it in the context of a protocol where we accomplish 2 things. We make something that's maybe hope and promising for someone. At the same time, we determine whether or not it's safe and whether or not it actually does work. I wasn't dismissing it. I was saying we need to be careful.
I appreciate that clarification. You did your undergrad at Holy Cross in Massachusetts. And I'm just going back to the first answer you gave me about several more weeks of this. Easter Sunday is 3 weeks from this coming Sunday. And can you say whether or not we'll have a great Easter Sunday, American resurrection on that date?
You know, I can't predict what the situation would be. I think we need to be prepared to modify behavior even when it involves things that are very close to our heart.
Okay, so then if that's the case then, how do we know when we're turning the corner, doctor?
Well, you know, when you start to see things turn around, I mean, you mentioned the Korea curve. I mean, the China curve has already gone up and down. There are fewer cases per day in China than most places that we're dealing with. In Korea, it went up and just started to turn down and flatten out. Once you see that you're going the other direction, then you know you're turning the corner.
Well, keep at it. So many are relying on you for information and knowledge and understanding. Thank you for your time today. Dr. Anthony Fauci in Washington, D.C., good luck. We need you.
Thank you.
Thank you.
Thank you.